In the context of immunotherapy, we have a lot to learn from melanoma. This year at ASCO, a major phase 3 trial compared to nivolumab alone or the combination with ipilimumab to ipilimumab, and both of those arms, both nivo arms, showed a significant survival benefit. In patients with PD-L1 expression, that survival benefit was particularly pronounced in the nivo arm. In those without PD-L1 expression, the combination seemed to elevate patients above what we'd expect with ipilimumab alone. And the big question in my mind, particularly as we start going forward with clinical trials looking at immunotherapy combinations in non-small cell, is whether the observations seen in melanoma will extend to non-small cell. This is purely conjecture on my part, but one wonders whether PD-L1 expression really is the secret to determining who's more likely or less likely to benefit. There may be other surrogates. For instance, mutation burden may be equally good, perhaps preferential way of determining who's going to have a greater benefit from the newer immunotherapy agents. Smoking history may be the ultimate surrogate. Certainly it's a lot easier to obtain, a lot less costly. We don't do a good job. Most of these trials have separated patients by whether they were former or current smokers or never smokers, but they've never gone into the details about smoking history, how many pack years when the patients quit. And it would be really interesting to correlate both mutation burden and PD-L1 expression with smoking history. There are certainly exploratory studies now looking at combination CTLA4 inhibitors and either PD-1 or PD-L1 inhibitors. Bristol Myers Squibb is initiating trials of nivo with ipi. AstraZeneca is initiating trials of their PD-L1 inhibitor with tremelimumab, which is a CTLA4 inhibitor. So stay tuned. There'll be a lot of data, hopefully showing something similar to melanoma, although that remains to be seen. But I think in the context of the next wave of treatment, we are going to be looking at immunotherapy combinations. And whether that is equally transformative to the therapeutic landscape remains to be seen, but certainly holds quite a bit of promise. And this is coming from an individual who was, without question, an immunoskeptic.